euthanasia, I'll get 4 hemangiosarcoma patients from my euthanasia business a week.
Wow. Wow.
Horrible.
Wow.
Wow, that's crazy.
Mm-hmm.
And like when you started, how often would you say would you
Yeah,
get
I would
that?
say hemangio, I'd maybe see once a month.
Wow.
Maybe twice a month at the most when I first started.
Yeah.
And now, a pit bull at 10 years old walks through your ER clinic not feeling well. You're like, oh, where's the hemangio?
Wow.
That's such a crazy statement because to you, cancer is happening so much that you have enough experience to instinctively possibly know what the illness is within that animal.
Yeah.
Cancer is happening that much more today than it was 22 years ago.
Yeah. Can I mention one other one? I just have a feeling, I feel like I have to mention this one. Hemangiosarcoma.
Yes.
The ones that come in that are bleeding in their abdomen. Hemangiosarcoma is a very common cancer in dogs right now. It's most often on the spleen, and we don't know it. I've lost 2 dogs to it. Dogs who I knew were predisposed because of their breed, who I ultrasounded every 4 to 6 months as they aged and still didn't see it before they ruptured. Because that's the nature of it. The tumor comes and we don't know. There's no outward symptoms until it starts to bleed.
Wow.
And so these dogs come in after collapse or weakness, and we find that they're bleeding into their abdomen. Now, often owners are only told the only options for this dog are surgery to remove the spleen, emergency surgery, or euthanasia. Now, depending on the case, sometimes that may be so. Some dogs are too far gone to consider anything else. Age is something to consider too. Is it a 14-year-old dog with hemangio, or is it a 10-year-old dog? But a lot of hemangiosarcomas can be managed holistically with Yunnan Baiyao, which I always say wrong, but for months and even up to a year. And I've even heard of 2 years in the rare instance. So I do feel people give up on hemangio a little bit too soon. I just felt I wanted to say that if you're in the ER, you get that diagnosis, just take a minute. Take a minute. Take the dog home and say, let me just take the Yunnan Baiyao and take my dog home and think about it overnight. And if I have to get a home euthanasia vet, I'll do that. Right? If surgery is not what you want to do.
We know we have had a few cases where pet parents have come to us for support for this cancer, and we do know that turkey tail mushrooms actually helps to extend the life of dogs, specifically with hemangiosarcoma. So dogs that are supplemented with this supplement can actually live longer. So there's studies for this.
Yeah, there's a lot you can do for hemangio. And turkey tail and the Yunnan Baiyao are 2 that are really great for it.
Yeah, I think in general, getting second opinions as well, or, taking time to think, especially also before you mentioned antibiotics and things like that. So I think pet parents can always ask the vet, is this a life-threatening situation? And if it's not a life-threatening situation, then, we have some time to consider a second opinion or other options as well.
When it's down to euthanasia, right? If your dog, and they're saying, okay, euthanasia would be the best option for your dog, and your intuition is like, oh, I don't think that my dog's ready. Listen to that intuition. Say, what else can I do just to manage my dog's symptoms, my dog's pain for right now while I sit with this? Is it possible to manage my dog's pain in this state with what's going on so that we can just sit with this?
Yeah.
Because that's a very, very big decision. And you don't want to make that decision under duress in a state of where you don't have a moment to think about it.
So true. Yeah. Thank you for adding that. Hey guys, if you've enjoyed this video, definitely listen to the full podcast, which is coming up in the next video to dive deeper into this topic. Subscribe to our channel so you never miss an episode.